Good afternoon. My name is Kevin Anderson, and this is my submission for Communication 233, Healthcare Communication for Health Professionals. And this is my personal interview assignment with a healthcare professional. Here today I have a very special guest, a good friend of the family. Would you like to introduce yourself and tell me your name?
My name is Blantrice Jarman.
And where are you from, Miss Jarman?
I am from Natchitoches, Louisiana.
Great, you're from the Boot. Good people down there. I like that.
Good.
How long have you been here in Houston?
Since 1995.
Oh, so you're an honorary Texan now. You got your license and everything. You're a resident. Okay. Do you have any children? Tell me about your lovely family.
Yes, I have two children, Melvin, who is 14, and Victoria, who is 9. And I am married with 4 stepchildren.
Ladies and gentlemen, we have a woman of the new millennium, a full-time mother and worker. That's very good, very impressive.
Thank you.
So at this time, I would like to learn a little bit more about your employment, your background, and why don't you tell me a little bit about that?
Sure. I currently work for Methodist Hospital. I'm an item file coordinator for supply chain management, corporate level. I have 9 years experience, and I have 12 years of healthcare experience. Before I worked for Methodist, I worked for Harris County Hospital District for 3 years.
Oh, wow. And what did you do for the Harris County Hospital District?
I was Administrative Secretary 1, where I scanned in all the policies and procedures for pharmacy administration.
Wow, so you definitely know your way around the administrative side of the healthcare profession. That's pretty good. So how would you say that you tend to manage balancing your professional life with your home life, being a mother and all of that?
It is kind of hard. I have a flexible work schedule because I am still a current student of Texas Southern University. So I do attend school during the day. However, my job works with me to have my work day and my meetings around my school schedule. And I still have to make time for family time.
That's pretty nice that you're allowed that flexibility, because I know that's a big thing for parents who are professionals to be able to still work and maintain their household at the same time. So tell me, did you know early in life what you wanted to be when you growed up?
Yes, I wanted to be a doctor when I was a little girl. However, when I grew up and started studying biology and math, I have a very, very bad kinks for blood, so I decided to go another route for the healthcare industry.
I totally understand. I totally understand. So how did you know that you wanted to be a doctor? Was this something that was always in you, or did you have some sort of it's something that kind of was a call of duty?
Well, I love to serve in any way possible, and I want to have direct patient care. However, with that, fear, that kind of pushed me back to have inpatient direct care, but however, I'm still providing patient care.
Right, just on the administrative side of things, which is also very important, just like the clinical side is. So did you have a teacher, a neighbor, or any family members that may have been a role model to help influence you into the field that you wanted to go into?
Honestly, I did not. I just knew that, I was actually working for HISD, and Harris County needed someone to scan in their policies and procedures. And it was a contracted job, but it ended up changing my life, my aspect of life.
Okay. So would you like to briefly describe your formal education for me? What kind of degrees are you working on, or have you already attained any?
Well, this December I will be graduating from Texas Southern University with my bachelor's in business administration, graduating cum laude.
All right, go Tigers! Congratulations!
Thank
I'll
you.
be right behind you in May.
Yay!
So, was in the course of your tenure here at TSU, was a communications course required for the reception of your degree?
Yes, it was. And I was actually recommended to take a business professional communication course. However, it did not entitle with my schedule for this semester, but it is definitely recommended.
Like most course loads, recommend you to take communication because it's an important factor out there in the professional world to be able to communicate on a professional level with your colleagues. So how do you plan on continuing your formal education? Is this your last stop here at TSU, or do you plan on going even further?
I plan on pursuing my PhD within the next 10 years.
Oh, wow. So with that PhD, that's a pretty lofty aspiration. With your PhD, what is your ultimate goal with that professionally?
I would like to become a COO, a Chief Operating Officer for a healthcare industry.
Wow. Well, you say you've been with Methodist for 9 years now. You may just be well on your way.
I hope so.
I hope so too. Let's keep our fingers crossed. So let's delve a little bit more into what your responsibilities and roles are on the job. What are they, and would you say they've changed over time?
They have. When I was hired, I was a contract librarian where I just scanned all the contracts and kept record of every contract for the system.
Right.
Methodist currently has 5 entities, and I work for each one. Since then, I am now a item file coordinator where I make sure all the pricing along with the contracts are intact for each entity. I deal with vendor disputes, accounts payable issues, as well as supply chain issues.
Oh, Ms. Jarman, sounds like you're a very important lady over there at the Methodist Hospital. Okay, sounds like you keep things rolling. What would you say are the favorite and least favorite things that your job entails?
The favorite thing is the challenge. You know, I go in every day. I'm not sure what's on my plate or what's on my agenda, but it's the challenge. The least thing I do not like about my job is not being able to have face-to-face interaction with the other employees at the other entities. Because I'm housed at corporate level, I'm not able to see them to understand what they're going through. Their communication is given to me through, emails, voicemails, and sometimes web meetings.
Right. Okay. So, what would you change about that? How would you implement something that would make it a little easier to communicate face to face?
I would have meetings with them on a monthly basis just to get their aspect and what they're going through, their struggles, because I understand that we all have struggles. We're implementing a new system into our whole hospital, and I want to understand what they're facing versus me just, assuming and not being, correct about what they're going through.
Right, because that's crucial in management, right? Being able to actually get in there and talk to your subordinates and your colleagues and see what's actually going on out there in the field. So what would you say are your communication strengths, and what would you say some of your weaknesses are in communication?
My communication strengths would be I'm able to listen and then adhere to what is being told to me. I'm able to understand and comprehend. My weakness is sometimes just not talking, just listening. Sometimes when you listen and you talk, you might not get everything that the person is saying.
Right.
So I try to just listen to get the whole complete understanding of what they're saying, and then provide feedback if needed. Sometimes feedback is not needed.
Sometimes, yes. That's very important to remember. You should always listen twice as much as you speak. So, how do you think that you could become a stronger communicator?
By listening.
By listening, exactly. Have you had any cultural competency training to assist you in working with individuals from different cultures, backgrounds?
Well, Methodist, we actually have a international research institute.
Oh, really?
Where we have physicians and nurses who actually go over to Middle East, such as like Dubai, and work over there. We do promote cultural diversity. We feel that we embrace diversity and the cultures of other races. So I'm able to listen effectively, attentively to them because I have not had the proper training. However, since my corporation embraces it, so do I.
Right. I know from my experiences working at the Methodist Hospital that you work with so many different cultures and nationalities that it is really crucial and imperative that you know how to communicate effectively with your coworkers or especially your patients.
Yes.
If you're on the clinical side of things, you definitely have to make sure that the lines of communications are open, and if there's no one there, you have to find someone that can bridge that gap.
Yes.
And with that being said, how do you handle those barriers in communication when they arise? Do you call in an interpreter, or do you know any languages or working on